We will now continue agenda item 3, matters arising from the World Health Assembly and the Executive Board. The relevant documents can be found in EU/RC69/6, EU/RC69 INFDOC/2, EU/RC69/INFDOC/3, EU/RC69/INFDOC/5, EU/RC69/INFDOC/6. This is a very important topic, and the outcome of our deliberations on this topic is an important element of the report of the President of the Regional Committee to the Executive Board. It is our opportunity to present the views of our region in the global debate. We will look at the different documents separately, so to give opportunity to clearly state your views. We will start with a review of the technical resolutions adopted by the World Health Assembly that are of particular importance for our region. They can be found in EU/RC69/6, and I will invite Uti Kuivasniemi, Deputy Director for International Affairs, Ministry of Social Affairs and Health, Finland, functioning as liaison with the Standing Committee of the Regional Committee, to brief us. Uti, please.
I am giving this statement on behalf of Finland, member of the Executive Board Bureau, and in that capacity, a liaison between the EB and the Regional Committee and the Standing Committee. I will provide a very brief update on the outcome of this year's World Health Assembly, where we adopted 16 resolutions and 24 decisions. I think this is very impressive. However, I will focus only on the items that are of particular relevance to our region. Decision WHA 7211, follow-up to the political declaration of the third high-level meeting of the General Assembly on the prevention and control of non-communicable diseases. Our region has been leading in the prevention and control of non-communicable diseases, and I am sure that you agree with me that we would like to keep it that way. The WHO European region is gearing up to achieving SDG target 3.4 earlier than 2030 and will most probably exceed it. Furthermore, within the WHO European region, implementation of progress monitoring indicators has improved significantly over the last 2 years. Nevertheless, globally, the progress and the investments made are inadequate to meet the SDG target 3.4 by 2030. In 2024, WHO will report to the UN General Assembly on the national commitments set out in the 2011 and 2018 political commitments and a 2014 outcome document on NCDs. There are several regional action plans that have been critical to achieving significant gains across the WHO European region, and many of them need to be renewed or reviewed in the coming year. An overview of these expiring action plans has been developed by the Secretariat and can be found in EUR/RC69/INFDOC/1. The Secretariat is committed to provide a report to WHA in 2020 through the EB in January 2020 in full consultation, that is face-to-face public web and web-based consultations with member states, on implementation of WHO's global strategy on harmful use of alcohol, and it is supporting discussions at regional level for the development of a roadmap to strengthen implementation of the European Action Plan. The UN political declaration broadened the scope of the commitments from the 4 major NCDs and 4 main risk factors, the so-called 4x4 NCD agenda, to include commitments to reduce air pollution and promote mental health and well-being, the so-called 5x5 NCD agenda. Mental health and air pollution best buys will be considered by the WHA in 2020. This is welcome and reflects also the priorities of the European member states and the already endorsed action plan for the prevention and control of NCDs, as well as mental health in the WHO European region, and that air pollution and health are a well-established priority in the European environment and health process. Resolution WHA 72.5 on antimicrobial resistance. Good progress is being made in the European region on the implementation of the objectives of the European AMR Action Plan through a One Health approach established between human and animal health and the environment. However, despite steady progress, much work still needs to be done throughout the region. Collaboration across sectors remains a challenge, and many countries indicated that they have no formal or functional multisectoral governance or coordination mechanism. With regard to health systems, I want to draw your attention to several important resolutions and decisions adopted during WHA 72. And of course, as you are well aware, we will have the high-level meeting in the UN General Assembly on universal health coverage in a few days. Resolution WHA 72.3, Community Health Workers Delivering Primary Healthcare Opportunities and Challenges. The topic of the health workforce is of particular importance to our region, and the implementation of this resolution should be taken into consideration when implementing the several initiatives in line with the Regional Framework for Action, which we adopted in 2017. Resolution WHA 72.6, Global Action on Patient Safety. Again, this is a topic where the European region has been a driving force for global work, and enhancing the quality of healthcare and patient safety has been for many years high on our agenda. Close collaboration with different actors involved, including professional and patient organizations, is needed to move this forward. We count on the Secretariat to guide national authorities further in this. Resolution 72.7, Water sanitation and hygiene in healthcare facilities. The regional priorities and actions as defined by the 2017 Ostrava Declaration and the WHO UNECE Protocol on Water and Health fully aligned with this resolution. It shows the commitment of our region to improve and maintain access to safely managed water, sanitation and hygiene, or WASH, services in healthcare facilities, especially in rural areas. Resolution WHA 72.8, improving the transparency of markets for medicines, vaccines and other health products. This resolution is the result of an intensive consultation process. The price negotiation process is a matter for the member states and is subject to national and regional frameworks. However, WHO can support this by providing specific technical assistance, by working with the member states to understand those frameworks more clearly, and to encourage collaboration through regional networks, such as the WHO-supported Pharmaceutical Pricing and Reimbursement Information Network. Resolution 72.16, Emergency Care Systems for Universal Health Coverage, ensuring timely care for the acutely ill and injured. WHO Regional Office is supporting the Member States to strengthen the continuum of care, including the provision of time-sensitive and emergency care, aiming at the highest standards of professionalism across all functions and specializations. Moreover, lastly, two important decisions. Decision WHA 72.9, WHO Global Strategy on Health, Environment and the Climate Change. The transformation needed to improve lives and well-being sustainably through healthy environments. And decisions WHO 72.14, promoting the health of refugees and migrants. In both areas, we have been proactive in our region with long-standing work on environment and health on the one hand, and the other, the resolution RC69/8 on migration and health. Dear Ministers and representatives, it is important that we ensure implementation of the globally adopted resolutions and decisions in our region, but also that we voice our input in the development of these global action plans and strategies. Under this agenda item, we are not only giving our feedback to the Secretariat in our region on how we see the implementation of the WHO resolutions and decisions in our region, but we also have an opportunity to give comments on what we see as priorities for the next years. It is clear that we have a lot to do, both globally as well as within our region. Thank you for your attention.
Thank you very much. Are there any delegates who wish to comment or question? Please rate your nameplates, if so. I see Italy, followed by Norway.
Okay, thank you. Thank you, Mr. Chairman. As you know, in May 2019, WHA adopted the resolution on the transparency of market for medicine, vaccine and other health products that was put forward by Italy and then supported by a wide number of the member states, including in the Euro region. The delegates who discussed the content of the resolution during WHA agreed that for a number of reasons, we have to identify a new balance in the market, one that can effectively address the need to develop products meeting public health priorities, such as antibiotics, and on the other makes all innovations available universally to their population. In this context, there is a significant risk of increasing inequalities in terms of access to essential health products within and among member states. While we acknowledge the importance of differential pricing among member states, we strongly believe that improving the transparency of market for medicine is key to improve policy decision, to increase competition and therefore stimulate the development of functional and competitive markets. Italy is committed to follow up on the resolution. Very recently, a decree of the Italian Minister of Health together with the Minister of Economy and Finance, updated the rules that regulate the negotiation procedures between AIFA, the Italian Medicine Agency, and pharmaceutical company requesting the reimbursement of medicine by our national health system. The decree includes some important aspects related to transparency. In particular, the pharmaceutical companies seeking reimbursement from the national health system are requested to provide information on marketing, sales and reimbursement in other countries, including negotiated prices. Moreover, information should be provided with regard to public contribution and incentives received on research and development programs, as well as clear and up-to-date information on the patent status of the concerned medicinal product. Finally, the pharmaceutical companies, as part of the final agreement for the medicine reimbursement by the national health system, will be obliged to provide annual reports regarding sales data, reviews, and marketing expenses. The new rules represent a first step that our country has made toward the implementation of the recommendation included in WHA Transparency Resolution. We have also started with some of the co-sponsors of the resolution and other member states, including the Valletta group of countries, to discuss possible follow-up actions. However, we strongly believe that any meaningful step forward towards improved transparency can only be made by working all together and cooperatively, designing a realistic and feasible roadmap towards the final objective through a step-by-step process. Therefore, we encourage all member states of the EU region to join these efforts for increased transparency, which is critical to improve access to essential medicine and health products toward the achievement of universal health coverage. Thank you, Mr. Chairman.
Thank you, Italy. Norway, please, followed by Switzerland.
Thank you.
Thank you, Chair. Speaking after Italy, our intervention will also be on the milestone resolution adopted by the World Health Assembly this year on improving the transparency of markets for medicines. Norway would like to thank Italy for the leadership they demonstrated on this issue. We'd also like to thank the European representative of the Executive Board for highlighting this resolution in her statement. High and in some cases unreasonably high prices on medicine threaten the sustainability of our health systems and our ability to provide universal health coverage. It is challenging that industry is willing to lower prices in exchange for secrecy on prices, thereby providing incentives for less transparency. This represents a democratic problem in the sense that we presently are not able to justify to the general public why we accept the introduction of some new medicines into our health systems while having to reject others. The continued legitimacy of our system for prioritization is dependent upon more publicly available information on prices of medicines and other health products across countries. The effect of this system is a lower level of good health in Norway and probably in most countries. Medicines that would benefit patients are not being used to the extent they should. Last year, Norway decided to turn down 51% of new medication and methods considered in our national prioritization system due to high prices, sometimes combined with lack of clinical data. To us, this is a public health concern. This is why we see the World Health Assembly resolution as a potential game changer. The resolution itself, however, will not change the reality. Our country insisting on transparency on prices risks being referred to list prices, hence being able to introduce fewer new technologies to their health service. The result may be a loss of health in patient groups. The resolution provides an opportunity for change. For the first time, the World Health Assembly has had an open discussion on the challenge of ever-increasing medicine prices and come up with a number of measures to counter this. It is now up to us to look for the next steps to increase transparency and improve pricing policies. And we need to move forward together, like Italy just said. Norway collaborates with Italy and with other groups and countries to follow up what was agreed in the resolution. Our sub-regional networks are engaged in the same work. Collective action is needed to make progress. Also, we would encourage member states of the European Union to engage in this work for increased transparency in pricing. It will benefit our ability to continue to deliver universal health coverage. Thank you.
Thank you, Norway. Switzerland, please.
Madame la directrice régionale, Monsieur le Président, chers délégués, la Suisse remercie l'OMS pour son engagement dans l'élaboration du projet de stratégie mondiale pour la santé numérique en étroite consultation avec les États membres et les bureaux régionaux. L'utilisation de la technologie numérique en santé est essentielle pour progresser vers la couverture sanitaire universelle. Nous espérons que la mise au point de la stratégie permettra d'établir des standards d'interopérabilité et des lignes directrices pour la sauvegarde de la confidentialité des données de santé et de réduire la fracture numérique entre les pays riches et les pays à faible et moyen revenu. À ce titre, la Suisse se réjouit de participer à un dialogue constructif en vue de l'établissement d'une feuille de route européenne pour la numérisation des systèmes de santé. La Suisse salue également l'élaboration d'une stratégie globale sur la décennie du vieillissement en bonne santé 2020-2030. Permettez-moi de revenir sur quelques éléments importants pour la mise en œuvre de la stratégie au niveau régional. Nous saluons les approches multisectorielles et multipartites de ce processus, la prise en compte d'une vision centrée sur le patient et son implication dans la rédaction d'un document est essentielle. Nous saluons également l'objectif de stratégique concernant le renforcement des données de la recherche et de l'innovation. Toutefois, la question de la santé mentale des personnes âgées est centrale pour la politique de santé. Même si elle est indirectement mentionnée dans la décennie, elle n'est pas clairement mise en avant. De manière plus générale, les aspects liés au vieillissement en bonne santé en Suisse incluent également les soins palliatifs et de fin de vie, ainsi que la planification anticipée concernant la santé. Mais ces éléments ne sont pas mentionnés dans le document. Enfin, la question de l'équité et de la solidarité intergénérationnelle mériterait également d'être soulignée, tout comme la nécessité de diversifier les modèles de santé et de protection sociale. La Suisse part de l'idée que le bureau régional soumettra les commentaires issus de la 69e comité régional également en vue de la consolidation de la stratégie globale qui sera à l'ordre du jour du prochain conseil exécutif. Je vous remercie.
Thank you, Switzerland. As I see no other delegation asking for the floor, I give now the floor to Stichting Health Action International.
Chair, Stichting Health Action International welcomes the opportunity to address this meeting. We acknowledge discussion of the working document matters arising from resolutions and decisions of the World Health Assembly and the Executive Board, noting with special interest Resolution WHA 72.8, improving the transparency of markets for medicines, vaccines, and other health products. We welcome the suggested implementation path, and while recognizing that any price negotiation process is essentially a member state competence, believe that the World Health Organization, through its European office, has been mandated to engage with member states to do more to improve access to medicines by increasing transparency of pharmaceutical markets and countering information asymmetries. We believe WHO could, for example, provide assistance to national authorities in the legal and administrative process of making WHA 72.8 operational at the national level. This should go hand in hand with other initiatives, such as the Global Strategy and Plan of Action for Public Health, Innovation and Intellectual Property, and its recommendation to shed light in an independent, accessible and reliable manner on the patent status of health products. Last but not least, we encourage member states to give due consideration to the report of the second edition of the Fair Pricing Forum and to support the efforts of its working groups regarding the linkage and transparency of the cost of research and development, among other critical elements of discussion. Thank you.
Thank you very much. And now I give the floor to IOGT International.
Honorable Chairperson, distinguished delegates, I thank you for the opportunity to address you on behalf of IOGT International. We commend the Secretariat's analysis of the challenges and opportunities regarding one important matter arising from the World Health Assembly, the global and regional response to alcohol-related harm. We are seeing a health and development emergency, but to be honest, too few political leaders are actually facing and tackling it. Implementation of the alcohol policy best buys has been low. Costs of alcohol harm are high, both in terms of health system burden as well as economy and productivity losses. And interference of the alcohol industry remains a serious problem. Therefore, we urge European leaders to face the harm that we are seeing in our communities, our families, and our societies. We call on you to make alcohol policy the priority it clearly should be. IOGT International strongly supports WHO Europe's 5 next steps outlined in the information document. To ensure best possible implementation, we call for an updated and improved European Alcohol Action Plan and much better resourcing for WHO Europe, commensurate with the severity of the alcohol burden. Thanks to the decision at the World Health Assembly, WHO is reviewing the impact of the last decade of the global alcohol strategy through a consultation process with member states. This is a unique opportunity to assess improvements and shortcomings. We call on our governments to engage substantively and to advocate bold new actions for the way forward, to achieve the progress that has eluded us so far. To facilitate proper discussion of the review and the way forward, IOGT International calls for a standalone agenda item on alcohol policy at the WHO governing body meetings in 2020. I thank you for your attention.
Thank you. And now we turn to the next document, EU/RC69/INFDOC2 on a draft global strategy to accelerate cervical cancer elimination. Following the Executive Board's decision at its 144th session, the Director General is requested to develop, in consultation with Member States and other relevant stakeholders, a draft global strategy to accelerate cervical cancer elimination with clear goals and targets for the period 2020 to 2030 for consideration by the 73rd World Health Assembly through the Executive Board at its 146th session. In accordance with decision WHA 65/9, the regional committees are asked to comment and provide input to the draft. I trust you all have revised the document, so without any further introduction, I will open the floor if there are comments. Are there any delegates who wish to comment? If so, please raise your name plates. I see Norway, so Norway, please.
Thank you, Chair. Norway fully supports the draft global strategy. We believe that the strategy is an important step in the work to eliminate cervical cancer as a global public health problem. The targets set out in the draft global strategy are sound, and at the same time, we would like to note that HPV vaccination should be implemented for girls at the age of 12 and not 15 as stated in the draft strategy. This is because the vaccine is more effective in preventing cervical cancer when provided before becoming sexually active. In order to reach the targets for 2030, we need to ensure access to the HPV vaccine, and we are supportive of programs to provide adequate and equitable vaccine coverage to prevent cervical cancer. Furthermore, we believe that follow-up and treatment must be offered free of charge for all women with screen-detected abnormalities. Finally, to achieve the 2030 global goal, it's important to consider setup of national cancer registries to monitor implementation and progress in the elimination of cervical cancer. Thank you, Chair.
Thank you, Norway. Hungary, please, followed by Austria.
The Regional Director, Chair, Honorable Minister, distinguished delegates, dear WHO colleagues. In Hungary, the policymakers are considering the country vaccination program as a success story. In fact, the routine vaccination program covers nearly 100% of the population. As a recent development, the scope of vaccination program has been extended for human papillomavirus for girls aged 12, administered in school vaccination campaigns and on voluntarily basis. The Hungarian government is convinced that the vaccine, in combination with the cervical screening program, is an effective tool of prevention. With respect to the link between certain cancers and some of the HPV stereotypes in men, the government is considering the introduction free voluntary offered HPV vaccine for boys as well. Regarding cancer policies, it is my pleasure to share with you the news that on 12th of June 2019 in Budapest, representatives of the countries of Central and Eastern Europe and Central Asia met for the first regional ministerial conference on partnership and cooperation in oncology in order to express their commitment to cooperate with each other and establish the Central and Eastern European Academy of Oncology. Representatives signed a declaration in the fields of oncological training, research and development. The participants reaffirmed their consent to share their methods and best practices of cancer control while supporting regional-level research and development. Considering the draft global strategy on cervical cancer, Hungary formulated and provided its opinion and comments during the consultation. Our overall concern with the draft is that the objectives to being desirable and strongly needed seems to be too ambitious and puts countries under unfunded pressure. The Hungarian government is ready to be involved for further consultation on the strategy. Thank you for your attention.
Thank you, Hungary. Austria, please.
Danke, Herr Vorsitzender. Österreich begrüßt die Ausrichtung des Entwurfs für eine globale Strategie zur Eliminierung von Gebärmutterkrebs. Der Entwurf ist konzise aufgebaut, spricht die richtigen Themenfelder an und unterbreitet auch geeignete Maßnahmenvorschläge. Auch im Hinblick auf humane Papillomaviren erscheint der Entwurf aus fachlicher Sicht berechtigt, sinnvoll und nachvollziehbar. Österreich ist mit etwa 400 Neuerkrankungen pro Jahr betroffen. Ca. 140 Frauen sterben pro Jahr an den Folgen eines Zervixkarzinoms. Österreich sieht in Umsetzung des Krebsrahmenprogramms auch den Auf- und Ausbau unseres modernen Krebs-Screeningsprogramms vor. Darüber hinaus ist in Österreich im Rahmen des Kinderimpfprogramms die kostenfreie HPV-Impfung für Buben und Mädchen ab dem vollendeten 9. Lebensjahr bis zum vollendeten 12. Lebensjahr vorgesehen. Österreich dankt daher dem Regionalbüro für die frühzeitige Mitbefassung an der Entwicklung für eine globale Strategie zur Eliminierung von Gebärmutterhalskrebs. Danke vielmals.
Thank you, Austria. And now I will ask Dr. Mikkelsen if she wants to respond to questions and comments raised.
Thank you, Chair, and thank you for the comments. First of all, I would like to say we are very pleased that 35 of the European countries has actually responded to the consultation, and we have had very productive and constructive inputs to the strategy. To the comments from Norway, according to the strategy, the recommendations is vaccination for girls between 9 and 14 years. The discussion on boys' vaccination raised by Hungary is still ongoing. I think for the Hungarian representative, we are very grateful for the initiative. More engagement is needed globally, and I think we can do global projections on European actions in this case. There are several countries that think this is too ambitious, and I would like to mark as well that, of course, we know that we have a very difficult and challenging situation, both with the cost of the HPV vaccine and also because we have constrained supply. At the moment, it's only 2 suppliers, and I know that the global level of WHO is working very hard to solve this situation. And also to hopefully get more resources to the initiative itself. In our region, we have 1 demonstration country so far, and that is Uzbekistan, and I thank Uzbekistan for putting themselves forward for this initiative. Thank you.
Thank you. And now we turn to the next document, EU/RC68/INF-DOC3, on the development of a global strategy for tuberculosis research and innovation. Resolution WHA 71.3 requests the Director General to develop a global strategy for tuberculosis research and innovation. In accordance with decision WHA 65/9, the regional committees are asked to comment and provide input to the draft. I would like to invite Dr. Masoud Darat to join us at the podium. So without any further introduction, I will open the floor for comments. Are there any delegates who wish to comment? If so, please raise your nameplates, and I see Slovakia.
Thank you, Mr. President. Slovakia appreciates the initiative of Global Strategy for TB Research and Innovation based on the most recent available evidence, which supports global and regional partnership to improve equitable access to the benefit of research by setting clear objectives and recommendations. Indeed, the success of TB control depends largely on effective prevention strategies, not only on country but also regional level and early diagnosis, including screening and adequate treatment of high-risk groups, in particular children from vulnerable groups who are in contact with TB patients. Slovakia, as a low incidence country, is pleased to contribute to this mission and endeavour a newly created WHO Collaborating Centre for TB. The main focus is on the TB elimination in vulnerable groups of population, monitoring and advocacy for health literacy initiative among vulnerable groups in Central Europe. In conclusion, we would like to highlight that provision of adequate comprehensive services is essential to break the chain of transmission, which is achievable only through strong and sustainable political commitment at all levels. Continual education of community health workers and engagement of risk groups on TB, but also other communicable diseases, including HIV, viral hepatitis, and neglected infection disease are needed. Thank you very much.
Thank you, Slovakia. Germany, please.
Vielen Dank, Herr Vorsitzender. Tuberkulose stellt immer noch eine große gesundheitliche Herausforderung weltweit dar und ist auch im östlichen Teil unserer Region eine große Herausforderung. Besorgniserregend sind insbesondere die hohe Zahl multiresistenter und extrem resistenter Fälle sowie Co-Infektionen von TB und HIV. Die vorgelegte globale Forschungsstrategie ist ein wichtiges Element zur Erreichung der Agenda 2030. Neben der Stärkung der Grundlagenforschung umfasst sie die aus unserer Sicht wichtige operationale Forschung, die sich mit der Umsetzung bzw. Anwendung innovativer Medikamente und Diagnostik befasst. Notwendig sind aus unserer Sicht innovative Ansätze, auch durch digitale Gesundheitstechnologien. Es ist zum Beispiel wichtig zu identifizieren, warum Empfehlungen in der Routinepraxis nicht umgesetzt werden. Auch brauchen wir ein besseres Verständnis über strukturelle, soziale und kulturelle Barrieren für die TB-Prävention, Diagnose und Behandlung. Darüber hinaus wird für den Erfolg der TB-Eliminierung auch sein, dass es ausreichend Trainingskapazitäten für Gesundheitsfachkräfte gibt. Denn nur dann werden wir die Eliminierung der TB erreichen. Herzlichen Dank für die Gelegenheit, hier zu sprechen.
Thank you very much. And I see no other asking for the floor. I would ask Dr. Dara if he has something to add.
Thank you very much, President, and thank you very much, Slovakia and Germany, for their intervention. Tuberculosis should have been eliminated long time ago, and it's a really pity that we are not being active enough in doing research and finding new treatments, new vaccines. But also operational aspects. Tuberculosis is linked to social determinants and also is a very good proxy for overall health coverage, universal health coverage, and inequities. At the regional office, of course, we have been collecting input and supporting member states to strengthen their capacities. Europe has a good capacity to do research. We established in 2017, under the regional director's leadership, a European research initiative. The European Research Initiative includes the key academics, member states, partners, NGOs, people affected by TB. And as a result of the work of this research initiative, a research priority plan has been prepared. What are the key questions in our region that needs to be addressed to the research? This is very much in line with the global strategy, and we are working further to strengthen the capacity of the countries. Very important, of course, latent TB. because our region particularly has been behind with addressing the prevention. So we need to further work on the latent TB as well as drug resistance and more effective treatment and, of course, the vaccine. Thank you very much.
Thank you, Masoud. And now we will consider the next document under this agenda item, namely document EU/RC69/INFDOC5 on the draft Global Strategy on Digital Health. Resolutions WHA 71.7 requests the Director General to develop within existing resources and in close consultation with Member States and with inputs from relevant stakeholders as appropriate, a global strategy on digital health, identifying priority areas, including where WHO should focus its efforts. I would like to invite Dr. Bernardo Mariano and Dr. Santino Severoni to join us at the podium. So without any further introduction, I will open the floor for comments. Are there any delegates who wish to comment? If so, please raise your nameplates. I see Austria.
Thank you, Mr. President. Austria welcomes the initiative of WHO to draw up this draft of a global strategy on digital health. But we also want to point out to the paradoxy of this document. There's not a single sentence wrong in this document, not a single sentence. It is a nice report about the potentials of digital health and why we all should concentrate on action and implementation. And it calls on us member states to implement this strategy. So I'm sure at the end we all will adopt this document easily because it doesn't hurt anyone. To be frank and open, most of us in this room, member states, have already started implementing digital health infrastructure 10 to 15 years ago. This document, to be honest, is much too late, much too late. Secondly, the document is missing important points. Digital health is not a self-fulfilling prophecy. We have to think about what defines the health data space we're all dreaming of or working on. And colleagues and friends and secretariat, the health data space is about sharing of health data which are created at the level of healthcare providers. And this point is missing in this document totally. I haven't even found the word healthcare provider in this document. So why are we, the public health system, want healthcare providers to share health data? We want them to share health data because of the continuity of care, because we believe strongly that we can enhance the quality of healthcare when the healthcare providers share data. It's about sharing data with databases for the sake of artificial intelligence. This is how we call it now, the new buzzwords. But it is to enhance the research. And of course, it is about optimizing the health systems in general. So these aspects are missing in this global strategy. So digital health is about infrastructure, digital health infrastructure at the level of healthcare providers. They are the ones who generate the data, health data, and that's what we want to achieve. The magic word in this whole concept should be interoperability, because healthcare providers need an infrastructure which is interoperable. So this is the magic word. It's not very sexy, interoperability. It's very complicated. But this is what we should concentrate on the interoperability aspect. And we have to ask, what is the role of the multilateral level? What is the role of WHO in this context? It's very simple. WHO is a normative organization. So we here in WHO can agree on the standards and technical prerequisites which create interoperability. The market alone doesn't do that. The vendors, the industry, they are interested in interoperability, of course, but we have to safeguard that from our side, the public health systems. So the member states of the European Union, we have agreed already on this set of standards and technical prerequisites which create interoperability. We even have linked the need of investment and the needs and the rules of procurement, public procurement, with this set of standards and technical prerequisites which create interoperability. And these are the aspects we have to concentrate on. Once again, this document is a nice document. There's nothing wrong, you know, it's a nice report on how important digital health is, but it is missing the necessities of implementation. And this is, to be sorry, you know, this is not a strategy, you know, which is useful for us in the member states. So I think WHO should concentrate, one, on the aspects, how can we create this health data space? How can we create this ecosystem where healthcare providers and research institutions, et cetera, can share health data? Secondly, we have to start talking very, very quickly about data governance. Once again, some of us have good regulations in that respect, but we have much more to do when it comes to the health data governance. And thirdly, we even haven't started this discussion, it's about the economics of health data. Who owns health data, under which circumstances can we use health data, et cetera, et cetera, et cetera. So these are the aspects which are missing in this strategy, and I would like to ask the Secretariat to revisit all these aspects and come up with a more sound and more helpful global strategy on digital health. Thank you very much.
Thank you, Austria. Germany, please.
Vielen Dank, Herr Vorsitzender. Ich warte, bis alle die Kopfhörer aufgesetzt haben. Neue digitale Technologien und Innovationen eröffnen viele Möglichkeiten, die Versorgung von Patienten zu verbessern und auch die Qualität der Versorgung für die Patienten zu verbessern. Telemedizin und künstliche Intelligenz haben das Potenzial dabei, WHA insbesondere auch in unterversorgten Gebieten zu verbessern. Wichtig ist uns, dass der Schutz persönlicher Daten in der globalen Strategie gewährleistet wird. Aus unserer Sicht sollte die globale Strategie zügig mit konkreten Zielen umgesetzt werden. Hierbei kann man von Partnerschaften profitieren und sollte gute vorhandene Entwicklungen nutzen. Für Fortschritte sind auch Big Data und künstliche Intelligenz wichtig. Auch dazu sollte die Strategie etwas sagen. Wir freuen uns auf den weiteren Austausch dazu. Vielen Dank.
Thank you. Israel, please.
Thank you very much, Chair. Israel Ministry of Health sees great value in the development of international digital health strategy, upon which international partnership and shared learning may be based. We welcome cooperation with WHO and member states, and we are happy to share our insights regarding this issue, and we have few insights which in general are quite close to what was said by Germany and Austria. So in a nutshell, I would just mention that we think we need better policy insight. We welcome, of course, the pioneering document, but we think it should be more clarified in certain points. We should have a generic approach. Interoperability was already mentioned, but we do believe that although each country has its own unique system, we need to speak in a much more common language between our different partners, and that would help us to interoperate much better. We think that the recommendation should be clarified and simple and clear in order to be able to establish a good guidelines to take this document into practical life. We believe that we need to address better the health provider needs. As already mentioned, they are not mentioned enough in the document, and we do believe we have to consult them and we have to bring them into the game in a much broader way. As I said, the last issue is from this resolution, which we believe would be adapted and we would strongly support, with the next step should be a clear guidelines for all countries, and we'll be happy to participate in that. Thank you very much.
I thank you very much. And as I see no other delegates asking for the floor, I give the floor to the European Medical Students Association.
Thank you, Mr. Chair. The European Medical Students Association appreciates the efforts of the World Health Organization, its member states and partners on the development of the draft digital health strategy. The digital transformation of healthcare will disrupt the workflow of health professionals, making digital health literacy and skills prerequisite competencies for the future health workforce. Education and training of healthcare professionals are key facilitators of digital health implementation. However, the implementation of digital health literacy and skills into healthcare students' education remains a lagging process in the strategy so far. A survey carried out by EMSA showed that 53% of European medical students participating in the survey considered their e-health skills as poor or very poor. However, the results also illustrated the wish of medical students for sufficient digital health literacy and skills. We see a clear gap between the willingness of students to become key players in a meaningful digitalization of healthcare and the competencies and skills they acquire through their education. To meet the needs of the future health workforce, respective competencies must be implemented into healthcare education. Therefore, EMSA calls on the World Health Organization and the European region to involve the importance of digital health literacy and skills for the future health workforce in the global strategy on digital health, and outline strategies for the enhancement of those competencies through implementation in undergraduate education and in continuous professional development. As a medical students association, EMSA would like to highlight the importance of meaningful youth involvement in the process. EMSA is ready to cooperate with the WHO on this matter in order to equip the next generation of health workforce with the necessary knowledge to successfully implement digital health and advance progress towards universal health coverage and the health-related sustainable development goals. Thank you for your attention.
Thank you very much. And now, let me ask Dr. Pernato Mariano to respond to the comments raised.
Thank you. Just to start perhaps with the comments from the delegate from Austria, sorry, apologies. Certainly the strategy has two parts, that one part which is the strategy, the other one is the annex, which has an action plan. And the action plan outlines what WHO expects to deliver out of that strategy, but also it outlines what is expected from the member states as well as partners. Interoperability in the areas of governance, including data governance, it's key. As the strategy was developed, and it is a 5-year strategy, we didn't want to put some of the buzzwords of today, like such as blockchain and AI, because maybe in 2 years we have a new buzzwords or we have a new hype. But certainly we included there areas of interoperability and data governance, which is really the underlying principle or and challenges that many countries face, be it with the health systems, be it with the AI, or be it with blockchain, to address issues such as portability, interoperability, data sharing, and even how to ensure that the data that is provided by patients is not just benefiting one part of one sector, being a private sector or multinationals. So but we will strengthen the action plan. We did not put the action plan together with the strategy as one document. Perhaps we will also do that to just make sure that the two sides are read as one, because more details of the strategy and the action and the expectation of the WHO, it is in the action plan, which is an annex. So when you access the document online, when you click on annex, it will take you to that document. But we will make sure that this is read as one document. So then the more strength into the strategy comes from that action plan. Yes, we being AI today's hype, we want to make sure that as the hype goes, as the reality sinks in, and then we get new hypes, we do not land with an outdated document in 1 year. The reason we kept the two documents separated, basically the strategy, global strategy, and the action plan, was exactly because of that risk of having a strategy that 2 years down the road looks like a 5 years old or 10 years old strategy that does not speak with the reality. And the idea is that the implementation or the action plan is reviewed every year to ensure that we remain on top of the very rapidly changing environment of digital transformation or digital health transformation. The strategy has these 4 objectives, 4 guiding principles, 4 objectives, but in the action plan, we have a framework for action. And that framework for action outline, for instance, prioritization of investment. So many countries, both ones that are well advanced in their digital health implementation strategy, but also the ones that are still at the early stages, prioritization of investment on data and digital health is key. So that is outlined in the action plan. But also issues such as ethics and privacy on data is also outlined as an action plan in an annex of the strategy. But as I said, we will bring that document forward. We will create basically one whole document that say have the strategy and annex, and we'll also seek your guidance to let us basically to guide us on this risk of having one strategy that is approved next year if the member states approve, and not having an action plan that is reviewed every year to address the changing nature of this area. I appreciate the comments from Israel, and there are many other countries that are well advanced in the digital health journey, and the strategic objective number 1, which is to promote global collaboration, is really to use the convening power of WHO to leverage that collaboration to ensure that the ones that are ahead and the ones that are still in the process, they learn from each other, and the mistakes that were committed that are not repeated, and then countries that are still in the early stage can leapfrog and benefit from those that have already gone through the process. The comment on literacy, it's key. The strategic objective number 4 is really to advocate on people-centric health systems to enable digital health. And then in the action plan, in that particular strategic objective, we speak about literacy and the need to equip the health workforce with the new tools and capabilities to really deliver the health benefits that we expect that these technologies that deliver. Also, the action plan talks about incubation and acceleration to scale up. So that is the innovation part. But we take the comments from all the member states to strengthen the document, and we will seek for your guidance in vis-a-vis merging the action plan and the strategy. And we have the document available online, but what we'll do now to just make sure that both documents are read by all member states, we will ensure that the two are merged, but we really seek your guidance in terms of how do we want these updates to be taken forward vis-a-vis the accelerated pace of change of this area, to ensure that 2 years from now, we still have a strategy and an implementation plan that's relevant of today at that stage of tomorrow's stage of the technology evolution. Thank you.
Thank you. And now we will consider the last document under this agenda item, document EU/RC69/INFDOC6 on the development of a proposal for a decade of healthy aging 2020 to 2030. Resolution WHA 69.3 requests the Director General to develop a proposal for a decade of healthy aging with member states and partners, which includes a plan of action for consideration by the WHO governing bodies. I would like to invite Dr. Alana Officer and Dr. Bente Mikkelsen to join us at the podium. I would like to open the floor for comments on this important document. If there are delegates wishing to comment, please raise your name plates. I have already seen Netherlands. Netherlands, please.
Thank you, Mr. President. The Netherlands would like to commend WHO for developing a proposal for a decade of healthy aging. The population in the Netherlands is, like in many other countries in Europe, aging rapidly. Therefore, we share the urgency to act in the field of aging. We support further activities in the field of aging as outlined in the strategy adopted by the Health Assembly in 2016 and as further elaborated in the present document on healthy aging. We would like to emphasize that this work on healthy aging requires sufficient capacity at WHO headquarters as well as in the regional and country offices. Ageism is widespread. It has harmful effects on older adults and must be addressed sufficiently. However, ageism receives also attention from other fora, such as the Madrid International Plan of Action on Aging and the UN Open-Ended Working Group on Aging. WHO should consider focusing on ageism in the health sector itself and to allocate capacity and funding in the most efficient way. As for the proposed indicators, we would like to underline that not all countries will need or will use national action plans and national focal points. In the Netherlands, we already use an integrated approach for elderly people in different policy fields, and we do not envisage the setup of a new comprehensive national action plan. Only at the very end, the document addresses how to involve other international key players in the field of aging to ensure that the work of WHO and partners on healthy aging will feed into broader activities and existing platforms on aging. Such collaboration could contribute substantially to address worldwide aging more effectively. Thank you.
Thank you. Spain, please.
Thank you, Chair. Spain welcomed the proposal for a decade of healthy aging to 2020-2030 and agree with the general guidelines of the document. But we would like to emphasize that although the actions to promote an active and healthy aging focus on the second half of life, we should not forget a life course perspective and the importance of health promotion at all stages of life to achieve a healthy aging. In addition, we must not ignore the social determinants of health framework, and we would want to highlight the need to address not only the inequalities linked to individual factors, but also those to the environment and social determinants of health, with the ultimate goal of achieving health equity in the elderly. In this regard, we also must take into account this framework in surveillance, disaggregating not only by age, but also by other axes of inequality, which can enhance the impact, both positive and negative, on health. Thank you.
Thank you. Germany, please.
Vielen Dank, Herr Vorsitzender. Deutschland begrüßt den Entwurf der WHO für die Dekade des gesunden Alterns. Erfreulich ist, dass bisher vernachlässigte Themen, beispielsweise die geschlechtsspezifischen Aspekte des Alterns und der Altersdiskriminierung, wie mein niederländischer Kollege bereits erwähnt hat, adressiert werden. Die Aktivitäten zu den 3 Säulen altersfreundliche Gemeinschaften, personenzentrierte integrierte Versorgung und gemeinschaftszentrierte soziale Versorgung sollten inhaltlich weiterentwickelt werden. Im nächsten Entwurf sollten dazu nun Zeitrahmen insbesondere für die Aktivitäten des Sekretariats festgelegt werden. Zur Umsetzung der Aktivitäten müssen die bestehenden Finanzierungslücken in den Gesundheitssystemen vieler Länder geschlossen werden. Um diese Herausforderung zu adressieren, ist es von zentraler Bedeutung, Menschen auch im höheren Alter im Arbeitsmarkt zu halten oder zu reintegrieren und so ein wirtschaftliches Return on Investment für Länder zu generieren. Hierzu sollte das Dokument weiterentwickelt werden. Darüber hinaus wünscht sich Deutschland eine stärkere Berücksichtigung des lebenslangen Lernens. In einer Gesellschaft, in der der Anteil alter und sehr alter Menschen stark zunimmt, sind Gesundheitsförderung und Prävention von entscheidender Bedeutung, um die Selbstständigkeit älterer Menschen so lange wie möglich zu erhalten und fortschreitender Pflegebedürftigkeit entgegenzuwirken. Aus diesem Grund müssen auch im Alter präventive Potenziale noch stärker ausgeschöpft werden. Dies sollte daher auch in der Dekade des gesunden Alterns Beachtung finden. Der von der WHO entwickelte Ansatz der lebensweltbezogenen Gesundheitsförderung bietet dafür eine sehr gute Grundlage. Vielen Dank.
Thank you, Germany. And Israel now, please.
Thank you, Chair. Israel strongly supports this resolution. We would like to emphasize a few points. First of all, we do believe, as it is in our society, that aging is a field with the biggest inequities in health, almost the biggest inequities in health, and we have to look into it. Aging in a healthy manner has to do with economical, social, and cultural ability to maintain proper aging. We are pushing strongly to convince our society to move the major scale of aging from institution back to the community and from the community back home. We are looking for many aids and tools how to support elderly people which prefer to stay at home and maintain their life in their common community with the society, the family, and their social network. Digital health, as was mentioned here, has many implementation in various fields, but certainly in aging. We are running now 5 major reach-out tenders in order to look for solutions for healthy aging and maintenance health at home for elderly patients. The last issue that I would like to mention, when still assistance is needed at home, many of our countries are using a health provider which immigrates from other countries. We have to do more how to integrate them into our health system, how to bridge gaps in language and mentality, and how to improve their training and ability to provide assistance and services. Thank you very much.
Thank you, Israel. And now, permit me to give the floor to the Northern Dimension Partnership in Public Health and Social Wellbeing.
Thank you, Chair. The Northern Dimension Partnership in Health and Social Wellbeing is very much welcoming the proposal for the Decade of Healthy Aging 2020 to 2030. Our partnership is joining the global efforts and has prioritized healthy and active aging as a cross-cutting topic in our future multi-annual strategy. Therefore, I can assure you that we are fully aligned with the initiative, will contribute to it, and would like to strengthen our links with WHO working on this area. Our partnership is currently developing a strategic policy framework for action with support of the seed funding from the Swedish Institute and our partner country, Germany. We are aiming more cross-sectoral collaboration, broadening the participation beyond the regular NDPHS actors by seeking for committed partners from civil society, academia, as well as from private sector. Interested stakeholders are welcome to join our initiative. The WHO draft proposal for a decade of healthy aging captures the main required action areas and activities quite well. It is highly appreciated that the combating of ageism will be an integral part of the activities. Our societies, to a large extent, are still age-unfriendly, where discrimination and negative attitudes towards aging are quite common. Misconceptions about aging that prevail among employers, social and healthcare workers, and among the older population itself are yet common. The evidence might be just the opposite. The loss of abilities typically associated with aging may be only loosely related to a person's chronological age and depends on the events throughout the life course. Persons with a healthy lifestyle and access to timely and qualitative health services nowadays are very likely to enjoy their older years successfully in good health, experience less limitations, and achieve things that previous generations would have thought impossible. And even people who are experiencing a decline in their capabilities can live more fulfilling lives and contribute to the society if they have an access to supportive services and environments. One area in the proposal that requires stronger emphasis is the life course approach to aging. We start aging from the moment we are born, and how our older years will look depends on various factors throughout our life. Knowledge, what to anticipate on the journey when we get older, is as important as maintaining healthy lifestyle and having access to preventive interventions early in life. We need to empower people to plan and prepare for their own aging and start this process long time before the second half of life. With this, I thank you for your attention.
Thank you, and now I will ask Dr. Officer to respond.
Thank you very much indeed, President, and to all of the Member States for your comments. In advance of today, we'd already had 26 of the 53 Member States from the region participate in one or more of the face-to-face or the online opportunities that have been provided as we develop the document. As you note, if we want to improve the lives of older adults, their families, and communities, the decade provides a really important opportunity. And I thank you very much for identifying additional gaps and providing directions on how we can strengthen the full document. Maybe just a couple of comments in response to some of the gaps and issues that you've raised. In terms of the work on ageism, so how we think and how we feel and how we act towards age and aging is something that affects us across our life course, but particularly in older age. Within the same resolution, Member States had asked WHO to lead with other UN agencies a global campaign to combat ageism. We have currently compiled all of the evidence on that, and we'll be launching that next year. While a particular focus is on the health sector, we understand from the evidence that ageism is incredibly prevalent in other sectors, and we think that it is important to continue with a multi-stakeholder, multi-sectoral approach to addressing this pervasive problem. On the issue of life course, yes, we understand that health in older age is really the accumulation of the advantage or disadvantage that people have experienced across their life course. This particular decade focuses on the second half of life. It does that because that aligns with the strategy that you adopted in 2016. It does that also because this is a population group which hasn't received sufficient attention, and because to do a life course approach in terms of aging would encompass all of the work that we do as an organization and that you do on health. So the focus really is on how we can maximize recognizing we need a life course approach, how we can maximize health in the second half of life. So in terms of your comments also around the broader multi-sectoral collaboration, just to say that we've had 16 other UN agencies who have been active in the development of the current draft. And they have really stressed a number of the gaps that you've also identified in terms of education, lifelong learning, in terms of work and employment and prolonging working life. Also addressing issues around equity. So that I hope you will see in the full draft that will be presented to the Executive Board a number of the gaps and concerns that you've raised adequately addressed. But thank you very much for your comments.
Yes, Dr. Very short, please.
I will be very short. First of all, I would like to reassure the Member States that this is one of the areas where we work very nicely together on the 3 levels, and we have done for years. Both from need, because there are very few resources actually on healthy aging, but also because we have already sort of defined how we work together. And just for your information, so we are very much aligned in this region. We are working on age-friendly cities, as you know. We integrate aging into all other programs, and we have been able to focus in this year with a renewed focus on long-term care and also how health systems respond to aging. So we will be very happy to also align further, and we will give a progress report and hopefully also a renewed roadmap to the next regional committee. Thank you.